Hi, my name is Brian Hill. I am a physical therapist and owner of Rehab United Sports Medicine and Physical Therapy. And these videos you're about to watch are because you recently had a knee surgery, and we want to make sure that you're getting back on your feet, moving and walking back to normal. And so we hope these exercises help you and progress you through your rehab and back to normal. Feel free to reach out to us if you have any questions or need anything. This is going to be a lunge position, so I'm going to get my surgical leg out in front. I'm making sure I have a handhold. If I'm not totally comfortable yet, make sure I have something on both sides, but I definitely want something on the opposite side. So I have my foot out in a lunge position. I've kept some width, and all I'm doing is weight shifting back and forth. So the knee bends and then returns, bends and returns. And I would do that 10 to 15 reps in a row. Then I would switch feet. I would put my left foot now in front and do the same thing. When I'm in this position, I want this knee straight and this hip extended. So now I'm just getting a nice easy stretch. If I need to shorten the stride to feel more comfortable doing it at first, that's fine. And then as I get more comfortable, take a longer stride. This exercise is called the march, pretty self-explanatory. So again, I'm gonna keep the surgical side on the outside. So if my right hip or knee had the surgery, I'm going to get my left hand to the table or to the countertop, and I'm going to weight shift over, meaning I'm pushing my hip as if it's going to the wall, and then I'm going to lift that opposite knee, and then I'm going to bring that foot down. Same thing on the other side. I'm going to lift, trying to use this hip flexor, and I'm going to repeat. And I just go nice and slow, weight shift, making sure I have a handhold. We can do those marches, and then as you get comfortable or more stable, you can pick up the pace. We're probably going to be somewhere in the 20 to 40 range in a row. Again, go to fatigue. If it's hurting, just take a break and then get back at it. The next progression of moving the leg here for gait and walking is called the lunge and return or step and return. So before I got in the position, I weight shifted back and forth. Now we're going to step forward. We have a handhold, and then we return slightly behind. So we're simulating the walking or gait positions, and we're getting the loading phase of gait, loading this hip and knee, as well as the swing phase. This is preparing you to walk without a crutch or without a walker.